Hey guys, my name is Kelly McIntosh and I'm here to present on rapid response teams for my evidence-based practice. Rapid response teams have shown statistical evidence in decreasing of codes in the hospital setting and precipitating codes in the hospital setting. The rapid response team is available 24/7. It has nurse support that consists of experienced nurses, and it's not just for patients, it's anybody within the hospital that requires immediate acute attention for cardiac arrest, respiratory arrest, or any other type of issues that require an emergency. The rapid response team does not only arrive for cardiac arrest or respiratory arrest, but they also round on patients within the hospital that are post-ICU transfer within the first 12 hours, any pertinent change in a patient on the floor, any patient with a tracheostomy. Now, some things that you nurses need to know as the floor nurse or any nurse within the hospital is if your patient has a tracheostomy tube at the bedside, they need to have an extra trach, they need to have oral suction or trach suction, and you need to know how to call rapid response if there's an emergency. You also need to make sure that your patient is on a pulse oximeter and being monitored for their saturations. Other things that rapid response rounds on is chest tubes. You need to make sure you have some sterile water at the bedside, and you need to make sure your patient is also monitored on a pulse oximeter at all times. Epidural pumps, they also round on. You need to make sure that your patient is aware of signs and symptoms. Therefore, if they start to have a reaction, they can let you know that at any time, and you can page rapid response. Reactions would be a metallic taste in their mouth, nausea, vomiting, severe headaches, or back pain. It's also really good to assess at the beginning of your shift and mid-shift that the epidural looks like it's placed properly, that the tegaderm is in place and there's no active bleeding, or that the epidural itself hasn't become dislodged. Heparin pumps are also rounded on by rapid response. You need to make sure that there's an accurate weight in the computer. You're supposed to be doing coags drawn regularly and then adjust your pump as ordered. Halo devices on patients need to require a wrench in the room. Chemo patients, you should have some chemo gloves at the bedside. Peritoneal dialysis catheter, you need to make sure that the procedure itself is being done properly along with the patient not being febrile. Diaphragmatic pacers, you need to make sure that there's 4 A's on the actual pacer, that their respiratory rate is set at the ordered setting, and that the patient is also monitored with a saturation probe, oxygen saturation probe. CWA protocol are for our patients that could possibly go into the DTs for alcohol withdrawal. There needs to be 2 orders. Patients need to have their SATs checked regularly and need to be acting as appropriately as possible on the CWA. That's something that you will check with your patients regularly and medicate them as appropriately. You also need to make sure that their vital signs remain within normal limits. Any suspected sepsis, that could be from possible procedures that they had, or they're showing signs of being febrile, decrease in urinary output. If a patient has wired jaws, you need to make sure there's wire cutters at the bedside. Continuous bladder irrigations, rapid response would also be called for that if there's any issues. You need to make sure that the urine stays a slight pink tinged, that there's no blood clots, and that their urine output is sufficient. One other thing is the Larry tube. Larry tubes need to have a size 6 ET tube at the bedside at all times, as well as a general purpose tray. When to call rapid response. So for emergent issues, you would call them for any airway issues, such as if the patient is apneic or they have a respiratory rate less than 8 breaths per minute. If their saturation is less than 90%, and that's for 3 minutes, and that's for more than 3 minutes after oxygen's been applied. Also, if they're having any trouble with airway issues whatsoever, you could call rapid response. As far as circulation, If a patient is bradycardic and the heart rate is less than 60 beats per minute, if they're tachycardic with a heart rate greater than 130 beats per minute, if they're hypotensive with a systolic pressure less than 90, or hypertensive with a diastolic greater than 100. Of course, you would want to assess your patient over a few minutes to make sure that this is indeed what their pressures are and not just call after you just see it one time. So cycle your pressures and make sure that you observe your patients. Neurologically, if a patient has altered loss of consciousness, acute mental status change, any unexplained lethargy or agitation, any seizures, stroke symptoms, which would consist of change in speech, facial droop, loss of extremities, that could be in the arms or the legs, any paresthesia, which is numbness or tingling in any extremities, or any new onset of chest pain, unresponsive to nitroglycerin. Once again, one of the best things you can do for your patients is monitor them regularly. You're going to assess acute changes in your patients, which would consist of uncontrolled pain. If you're giving your patient their PRN medication orders and maybe their breakthrough pain med orders, and they're still having an increase in pain and you've called the doctor, you might need to have rapid response on board. Any fluid status change, if the patient's urinary output is decreased for less than 30 mLs an hour, over a couple hours you would need to call rapid response. If there's any change in their skin color or any hemorrhaging whatsoever. Rapid response teams quickly respond to failing patients in and out of the ICU before their condition worsens, helping assure optimal outcomes. In conclusion, a nurse can call rapid response at any given time, 24 hours a day. Rapid response is not only there for acute respiratory and cardiac issues or for rounding on multiple patients, but they're also there to educate the nurses, the staff, the family, and the patients. So if you have any concerns whatsoever, you can page them at any time. And that is my presentation. Thank you.